At Gulf Coast Foot and Ankle Center, we believe when taking an impression for an orthotic, the only type that should be done is a non-weight-bearing suspension cast held in the neutral position, which gives you the best biomechanical functional orthotic device. We're going to demonstrate why this is the case and why Dr. Scholls' orthotics suck in their orthotic centers. Also, many of the computerized scans never quite capture the foot in a corrected position. Jess, if you'll rotate to your right and your left, you'll see that the arch goes up and down farther to your right. Stop, back in just a little bit, back to your left a little. That is where her foot should function. When she is fully weight-bearing and they're capturing her foot in a subtalar, unnatural, weight-bearing position that is already pathologic. We're going to show you the difference between that and the foam impression cast in a neutral position suspension cast. Now this is a demonstration of people who use foam boxes to cast for an orthotic. The foam box is placed under the foot. The foot is then pressed down and an impression is made. Once again, the foot is in a pathologic condition and position and nothing has been corrected at this point. This is the impression that's taken, and although some of the arch is captured, the foot is certainly not in a corrected position. Once again, the knee should be slightly flexed, the hip should be slightly flexed, the abdominal muscles should be relaxed, the subtalar joint, the talar head is palpated as it moves between the talus and navicular articulation, and when it is properly held, the foot should be held in that position. Mid-tarsal joint should be maximally pronated and locked, and the cast should be taken. Plaster would be around the foot, and what we wind up with is a cast that fully adheres to the foot. You get skin wrinkles, and from this a prescription is made that we send to the lab, and then we get the proper orthotic. Once again, one of the reasons why Dr. Scholls' orthotic centers clearly cannot cure a severe problem. This is a typical prescription that any of the doctors at Gulf Coast Foot and Ankle Center will carefully choose what type of orthotics for the activity, the size, the covering, and these are the various corrections that can be made. And without the doctors and their skillful knowledge and their experience, a machine can't do this. That's what we have to say to Dr. Scholl. Bye-bye. These are different type of inserts. This is similar to what Dr. Scholl would make. And you can see it adds very little support. And theirs are a little bit harder. This is something made out of graphite and fiberglass. You can see it's very hard, but you can also see it's very flexible the way the foot is supposed to move. A different type of orthotic would be one that would be cut out for someone who had a capsulitis, bursitis, or a drop metatarsal. A severe orthotic like this is one that moves not at all because that's for someone with the end-stage flat foot. We have orthotics with metatarsal pads. We have an orthotic like this that is specifically for someone with rheumatoid arthritis, very soft material with a raise right at the metatarsal area. And then if someone happens to have calluses or severe hyperkeratotic lesions on the bottom, the prescription's written after the lesions are appropriately marked and they're offloaded. So once again, superior knowledge equals a superior product, and it gives the patient the exceptional results that they deserve.